We brought a work we've done across several centres in the UK with the named patient scheme program of Venetoclax. And our focus on this poster was the patients who have had serial minimal residual disease determinations. Is very important because it's on a real world scenario, so it provides, I think, some valuable information. And our finding is basically that minimal residual disease is usually very deep with Venetoclax, as we knew from previous trials, and as it has presented here and updated results in this meeting. Patients who got MRD negativity went below the 10 to the minus 4 threshold of the iwCLL. Most all of them went below that, so that tells us that the drug is very potent. However, the other important, the very important result is that the time on MRD negativity was relatively short. We have to bear in mind that our patients were quite heavily pretreated because they belonged to the very first lot of patients that went into Venetoclax treatments, and they were obviously heavily pretreated with median of more than 3 lines of therapy, and most of them were actually 17p or p53 deleted. And these patients were in treatment with Venetoclax a median of approximately 18 months. Most of the patients who came off Venetoclax because of progression died very quickly afterwards. So I think the main message of my poster is that although the drug is very good and we get very deep responses, they will be transient, and we need to think about doing something with these patients as soon as they become MRD negative, because we will sooner or later lose that MRD negativity. Amongst those who lost MRD negativity and quickly progressed, we have one case of Richter's transformation which became very aggressive. So there is a hint that maybe the patients who are able to escape such a potent drug might actually have a more aggressive disease, a relapse, and that's something we would like to follow up in further research and accumulate more cases to see where that, if that gives a signal of more aggressive disease in the future. Yeah.